dealing with a large gland and good resection in short duration of time. The trick here is to take long chips and chips which are of good thickness, typically described as cano shaped chips. So this particular patient is a 86-year-old, around 80 cc prostate and having multiple comorbid issues. So my idea was to complete the surgery as soon as possible. As you can see in the inset video, I have taken a chip which is of around 3.5 to 4 centimeters. So during the initial phase of surgery, these kind of long and thick chips will help you to finish off the surgery fast. At the end of the thing, you can see the size of the chip is small. This is at the apex of the prostate. At the verumontanum, when you are trying to smoothen out the edges, the chips are usually small. So as you progress during the surgery, especially when you are dealing with the lateral lobes, the size of the chip is initially big. As you progress from the bladder neck up to the veru, the size of the chip will slowly come down, and also the thickness of the chip will come down at the end of the surgery. To achieve and have a good chip, you can see here, this is a Olympus Bipolar TURiS resectoscope. This is the maximum length of the chip that can be achieved with the loop. But if you want to have a much bigger length chip, what you need to do is, also with the resector, also with the loop, you need to move the resectoscope towards the verumontanum. So this is a tricky stuff, and it comes with experience. So when you are trying to do these movements, that is bringing the resectoscope towards you, sometimes we inadvertently cross beyond the verumontanum. So the idea is have a good thinking where the veru is, and then dip your scope, lock at the chip and gently come, and then use the resectoscope, use the loop. So in this way you can get a very good length and also good depth of the chip. So if you are practicing this, you can get a good chip and the surgical time will come down. Thank you and namaste.